from Universal Studios Hollywood. Welcome to Home and Family. Okay, she is back joining us now to talk about technology that is changing the lives of people who suffer from severe depression. Please welcome Dr. Kira Stein, who is here. Welcome, doctor. New technology where? Where is this technology coming from?
Well, it's a device called Transcranial magnetic stimulation, which is a non-invasive.
Okay, we're looking at it now.
Right
is
here.
that what we're hearing? Yeah.
Right there.
Okay.
And
it's a non-invasive, non-drug treatment for depression that is very effective.
A non-drug treatment?
Yes.
Yeah, and later on we have two patients that will be in who they're going to share their success stories with us and how this worked.
And that was a treatment there that we witnessed, a part of a treatment process?
It's one of my patients.
Yeah, oh, fantastic. Well, we're going to talk about that. Okay.
Did you know that depression affects over 17 million adults each year? And Dr. Karen Stein is here to help pull back the veil on depression and talk about TMS. It's an innovative treatment for severe depression. We want to welcome back Dr. Stein. Welcome, doctor.
Welcome.
Yes.
So, before I get, I want to know the difference between the brain, a depressed brain and a non-depressed. But you mentioned TMS at the top of the show. Let's revisit that.
So, transcranial magnetic stimulation, TMS, is a way of treating depression without medications using an MRI strength magnet.
Okay.
That is applied over the part of the brain that is underactive in depression.
No, go ahead. I just wanted to also introduce, I'm so sorry. So you brought this is a patient of yours that, and your name is?
I'm Carmen.
Carmen. This is Carmen. I just wanted to greet you as well, so please excuse the
so, doctor, the difference between a depressed brain and non-depressed brain would be what? How would it look?
Well, I think we have a brain scan here.
Oh, okay. Let's take a look.
Okay, great. So you can see this is a brain scan that demonstrates the differences in activity between a normal and a depressed brain. What do you see the difference? What's different?
Well, there's a color change there, the bright yellows.
Correct.
Right.
So a normal brain has more activity in the frontal lobe and actually in most parts of the brain. A depressed brain, it's literally depressed activity. You see less firing of brain cells, of neurons, from the frontal lobe going in deeper.
What does that cause in a patient when nothing is like lighting up like that? What are the symptoms?
Depression is a syndrome of symptoms, usually feeling depressed, meaning melancholic, a low mood, or it doesn't even have to be that. It could also be a feeling of a lack of joy, not wanting to do things, not being interested, or even experiencing pleasure fully. It also involves a lot of changes like difficulty sleeping, whether it's sleeping too much or sleeping too little, being exhausted all the time, or having too much energy and anxious and agitated. It also could involve difficulties making decisions, slow thinking, poor attention, and even if it gets bad enough, it could involve difficulties with thinking constantly about death or suicide.
Carmen, is that how you were feeling? What were your symptoms?
Actually, my symptoms started after a knee injury when I was 16, and I began to isolate myself from my friends and my family. I was just very depressed. Then knee injury sidelined me from cheerleading, and I just couldn't get out of bed. I didn't want to interact with anyone.
So, but may I ask, is it because of the injury that she had to her knee, or is this something that just develops in teenagers or young adults? Is it a natural progression of things?
Well, most people don't suffer from depression. 1 in 6 people do at some point in their lifetime. And it's usually predisposed genetically, meaning that people may have inherited genes that make them more likely to develop depression under certain stressors.
So the stress from the knee injury probably exacerbated that and brought that on?
And then having to give up cheerleading.
Now, that was at a very young age, a point in her life. If that injury had not occurred, would she still have experienced depression at some point?
It really depends on the type of stress that someone is going through. Inflammation is a type of stress. A physical injury, inflammation, an inflammatory process of some sort, which is a different type of injury to the body. traumatic stress can trigger the expression of genes that are pro-depression.
Well, there's depression, and then there's depression, because I suffered depression after menopause. I went through but I came through it. Mm-hmm. But I had some friends that did go through it, and they went into a deep depression, and the difference was like night and day. So how do you know when you need to seek treatment, and when you see somebody going through that, how do you approach them to say, how can I help you?
Two very good questions. You have depression if you're having trouble functioning, if it's really impacting your ability to engage in your relationships or follow through with work. I mean, the reality is that depression is one of the most common reasons for disability in the world. Meaning absenteeism from work, presenteeism from work, meaning you're there but you're really not functioning. Sure. So it's an issue of functioning.
We watched at the top of the show, we saw a little clip of what TMS, the process looks like. It more or less sounds like, and I thought for a second, is it shocking? Is it shock therapy?
No, we're not administering electric shocks at all.
Okay.
What we're doing is we're administering a magnetic field.
Okay.
Like an MRI.
Okay.
Carmen, you're pregnant. You went through this before you got pregnant, right?
Actually, before this pregnancy, but after my last pregnancy. I have a 22-month-old. So I actually was suffering from severe depression, and I had been for about 20 years. And my psychiatrist, Dr. Amanda Sparks-Bushnell, recommended the NeuroStar TMS treatment. And I began that probably my son was about 10 months old.
So what are the chances now? Would she suffer from postpartum depression? Will that come back? I mean, are you afraid that might happen?
Sure, there's always a chance, but my depression's in remission, and I have been, very healthy and very active since my treatment, and I've since actually started working for Dr. Sparks at Middle Tennessee TMS. So I'm actually their nurse, and I actually get to see the patients, and so they get to monitor me as well while I'm at work and see if I'm getting to a place where I might need treatment.
How did you know this was working?
It was probably about the second week. I had a friend that said, "Wow, you look so different," and I mean, I'd actually started by the third week showering every day like a normal human being and getting out of the bed. And I wasn't handing off my son to the nanny because I was constantly just handing my child off to the nanny or to my husband and not wanting to take care of my child.
Wow.
Well, so others sensed a change in you before you did? Like she noticed that?
Absolutely.
Yeah, but then it started to come around and
what was that like? What was that feeling like?
It was like a fog had been lifted that I had lived in for over 20 years. It was miraculous. I just felt so amazing. Like as a person, I had energy and I felt different. I felt like a new person. And it brought out a lot of qualities of myself, things that I hadn't experienced before that I wanted to do with my family and things that I wanted to experience, for myself for the first time.
Well, after the break, Dr. Stein's going to demonstrate how this process, TMS, works, and we're going to hear from another success story, a patient of yours, Megan. Another one coming up right after this as well.
With Dr. Kira Stein, and also joining us is Megan. She is a former patient of Dr. Stein, so welcome, Megan.
Hi.
Welcome. Okay, so let's talk about the commitment involved when you're doing a treatment like this.
Mm-hmm. Well, the usual protocol for TMS treatment for depression is roughly around 4 to 6 weeks, 5 days a week, of about 37 minutes per treatment. So it is a commitment.
It is.
Yeah, how were you able to manage the time commitment, Megan?
Well, I was really nervous at first because part of my specific symptoms with my depression was I wasn't able to get up and go to work and go to school, so I was really worried how I was going to get up and go to these treatments 5 days a week. But I made this promise to myself that I was ready to get better and I needed to get better, so I was willing to do whatever it took, and somehow I made it through.
Did you see an immediate change after the first treatment, a couple of treatments that helped motivate you even more?
I'd say about 2 weeks into it, I noticed it seems small probably to other people, but I noticed I was singing it in my car along to the radio. And I'd always loved doing that, and it's just a carefree thing that people do, and you never realize that, you know, depression even takes those little tiny joys away from you. And I noticed that, and I was like, okay, this could be working.
Well, what does this machine do? I mean, what signals does it send to your brain to make it clear up like that and start lighting up?
Well, basically, as I mentioned, it uses an MRI strength magnet field to cause the brain's cells to fire up, meaning to send their own electrical signals to deeper structures.
Sort of jump-starting them, if you will. If you will.
Basically, I mean, the most basic way of understanding this is the brain underneath this magnet is underactive when you're depressed. And all we're doing here is trying to activate it with the magnet.
When you activate it, does it stay activated or does it go dormant again?
Well, with only one treatment, it's more likely to go dormant.
Right.
One session. But we've figured out that usually roughly between 4 to 6 weeks of treatment really helps maintain the effect.
Have you done any studies to see how long this lasts?
Well, there recently was a study by the American that was presented at the American Psychiatric Association that showed that remission rates are pretty high, and maintenance of remission is pretty high with TMS.
Can you demonstrate, is this, we had this on a little bit before, but can you demonstrate how it works, or treatment will go?
No problem. Okay, so we've already set it up over the frontal lobe, which is what we're treating. And all I need to do is just start the machine.
And then, if you can take us through, you can go ahead. But
so what you're going to hear is a little chime, and then for about 4 seconds, there's going to be a bunch of pulses. Sort of sounds like a loud typewriter. Okay? And then for 26 seconds, there'll be a rest period, and then again, for 4 seconds, it'll repeat, and that'll go on, usually for about 37 minutes per session. Okay? All right, ready to go?
Yeah.
All right, good.
Now, what did you feel?
It feels like someone's tapping on your head with their finger.
Could you feel vibrations in there? Or
no, it just feels like a tapping. It feels weird at first, but you get really used to it, and it's definitely not painful at all.
Do they need to stay awake and present and focus or concentrate on anything as this is happening, or can they read a book?
I prefer that they stay awake.
Okay.
But we have patients watch TV, read a book, meditate.
What did you do, Megan?
I started out by watching I Love Lucy reruns. Just because I thought,
there you go.
I thought that would be sort of a happy thing, you know, to kind of take me through these sessions. But I actually ended up getting back to reading, which I love, and so I actually finished a trilogy during the sessions.
And how many times a week would this be required?
5 days a week.
5 days a week that you would do, that you come in.
But most centers are pretty flexible.
Yeah.
So before work, after work, I mean.
And
now, as far as insurance coverage goes, because there's so many options out there medication-wise, does insurance cover something like this?
More and more insurance is recognizing that TMS can be very beneficial for people with depression, and so more and more are providing coverage or offering coverage.
So what does the future of TMS look like?
Well, it's pretty exciting. I mean, I think it is a paradigm shift for the field of psychiatry. Medication is one option. Psychotherapy, of course, is an essential option. But this can be, studies show that it probably will be a potential treatment for anything that you can reach the brain with. So Alzheimer's, bipolar depression, not yet, it's not yet approved for these. Panic disorder, PTSD, post-traumatic stress, generalized anxiety, and the list goes on. So eventually, I believe that this machine will be used for other conditions, even post-stroke rehab.
Now, this has been around for a while, you said, this technology.
The technology has been around for a couple decades in research, being used in research, but only in 2008 did the NeuroStar TMS device, which is here, where we can see it right here, has it been available and FDA approved since 2008.
And is there because we talked about it, this is not shock therapy. The actual difference between the two is what? Is shock therapy actually going in and applying?
Shock therapy is actually inducing a seizure in somebody who is suffering from depression, usually. There are other conditions it treats. And usually they're sedated, they don't feel it. And actually it's a very effective treatment for depression, for very severe depressions. This is another option, though.
I like this option. It seems so much like gentler.
Yeah.
Yes.
Well, thank you so much, Doctor.
Thank you both. Thank you,
Thank you.
And if you'd like more information on TMS, you can visit Dr. Stein's website at wctms.com or Neurostar. It's Neuro Star, STAR.com. And thank you so much for joining us. And Megan again.
Thank you.
Megan and Carmen, thank you.
We'll be right back.